Hello and welcome to the Medicare EmPower Hour. My name is Erin and this is brought to you by BlackPoint Insurance. At BlackPoint Insurance, we help Medicare beneficiaries learn about the A, B, C's, and D's of Medicare, and we help agents and brokers nationwide learn to launch, grow, and retain their businesses. The Medicare EmPower Hour is all about doing education and training, bringing doctors from our community in here to profile of what they're doing, to making sure that every Medicare beneficiary is knowledgeable and every agent and broker feels ready to sell and be successful as we head into open enrollment and beyond. So I welcome you here today. My name is Erin Ackenheil, and I'm so glad to welcome you to the show. Today, I'm your guest speaker, so you're going to be seeing my presentation and also seeing a little bit of me as I walk you through the standard Part D design for 2023. So let's get started. All right, so first of all, let me tell you a little bit about BlackPoint and how we work in the community with agents and brokers. BlackPoint Insurance is a managing general agency. So basically what that means is we specialize in the Medicare space, but as a general agency, we support agents and brokers in the community to launch, grow, and retain their businesses. Now, what does that mean? A lot of people are hesitant to work with an upline partner. They're hesitant because they're not sure they're going to own or retain their business. They're hesitant because they think it's going to in some way affect their compensation. And all those things can be true with certain partners. But when you work with BlackPoint Insurance, not BrownPoint, when you work with BlackPoint Insurance, rest assured all of your business belongs to you. You're the agent of record on your business, and you retain full market level commission for all of your clients. What happens is BlackPoint works and partners and gets override payments for the business that you bring to us. And for return for that, we're not doing it for nothing. We're helping you to launch, grow, and retain your business, but we get override payments directly from the carriers. So it's really an incentive to work with a partner and get additional support. A lot of people have hesitation out there. They've been burned by partners before. Anyone who's worked with me, you can talk with any of the agents that I work with. I'm completely vested in helping you grow. So I want to remind everybody that we're live out there. You can ask a question, you can make a comment, you can throw a like to let us know that you're watching. So I encourage you to do that. And if any of my agents and brokers are listening out there, please feel free to share your experience of working with us at BlackPoint Insurance. My focus is helping you on training, helping to develop partnerships with local provider partners and carriers. It's to give you support through a CRM tool, which is a contract management tool, basically to keep track of your accounts and leads. We use Salesforce, and we've got it customized and designed exclusively for the Medicare business. So that's available to agents that work with us. We can help you with business planning, marketing support, pretty much anything that you want to do to grow your business. You can work with us at BlackPoint Insurance. But we don't hold the contracts directly with the insurance company. We go through our upline partner, which is Van Berg and Associates. Van Berg is what they call a field marketing organization, or an FMO. That partnership is a great partnership and connection for us. I chose to work with them because they're very reputable, easy to work with, and just really, truly good partners that understand what it means to be an agent, to understand your fears and concerns, to make sure that you're getting the support that you need. And Van Berg provides another layer of support than what I can do locally. They have, for example, tools to track all of your entire book of business through a system they call Agent Pit Stop. They handle all of the contracting. They have a whole marketing department that makes creative for me. They've worked with me for direct mail, postcards, leave behinds, flyers, member retention campaigns. They've helped me even recently develop a billboard for some of our agents in the New York market. They're just a great support to us, and that's an extra arm that's available to all of you as agents that you don't have to pay for when you're working with an upline partner. They help us with application processing. If you're still doing paper processing, I encourage you to stop spending the hours and hours of doing that during AEP and get access to the Sunfire tool that I'm going to showcase today in terms of tracking prescriptions. IT support, just never ending what they're willing to do for us at Van Berg. They also help track enrollments all the way through the process. So when you're busy at open enrollment, if there's a problem with one of your applications, they're going to track that down. If you need to provide something extra, they're there to provide that extra arm of support. Now, what they do is they work directly with the insurance companies, and we do all of our upline contracting through them wherever possible. So they get some pay directly from the insurance companies. BlackPoint gets pay. You retain all of your income and your commission potential, and you get all this laundry list of support. Because I don't know about all of you, but if you're running a small business, you probably don't have an IT department and a marketing department and a contracting department. You have yourself, me, myself, and I, right? So to have this list of support and help on the back end is really unique and helpful in this world as you're trying to grow your business. In light of that, let's get to some of the training for the day. So I just want to pause and remember, everybody, we're live out there. You can throw us a like, you can throw us a love, you can give us a comment, you can ask a question. I want to encourage you to do that. One of the ways that we grow at BlackPoint Insurance is through our social media presence. So if you want to share this with your friends and who are trying to grow their Medicare business, that's super helpful to us in terms of growth. We'd really appreciate it. So let's talk about the standard design for 2023 of Medicare Part D. You cannot buy Medicare Part D directly from Medicare, but Medicare is the one that establishes the standard design each year for the calendar year. And what happens is Medicare beneficiaries can essentially get their Part D drug benefits in one of two ways. They can buy it from a private insurance company as a standalone Part D prescription drug plan, typically paired with a Medigap plan like a Plan G for Great, or they can buy it embedded in a Medicare Advantage plan, a Part C plan, and it's part of the overall program along with their A and B benefits. Remember, those programs might have other restrictions, like network restrictions that you'd have to keep in mind. But essentially, the take-home message is they have to buy Part D in one of these two ways. And of course, you all know we're in the open enrollment period, which runs October 15th through December 7th. We're in the marketing phase of that, heading into open enrollment on October 15th. And this is the time for your beneficiaries, your clients, to add or change Part D prescription drug coverage or Advantage plans, or add it for the first time, or to make changes to their existing policy. So if you've been in the Medicare business for a while, like I have, hopefully you started gathering information from your clients as early as August. Hey, open enrollment's coming. How's your plan been going? Do you have changes to your prescriptions, the names, dosage, quantity? What's your preferred drugstore? Gathering all that information so that when open enrollment hits on October 15th, you've got those recommendations all lined up, and you're able to make this a streamlined process for your clients and be ready to go for new businesses coming on board as well. What you're looking at here is what government standardized for the year 2023. Now, all the private insurance companies out there, for example, if you're in San Francisco, if you're in California in general, there's 26 different standalone drug plans available in 2023 for your clients. If you're in other states, it's around the same number in most states as far as standalone drug plans. In terms of Medicare Advantage plans, where the Part D coverage is embedded as part of the program, there's a different number at a county level. Some counties have 0 additional options at Medicare Advantage. I've seen counties with 80 to 100 Medicare Advantage plans when you're getting into the big metropolitan areas. So depending on where you are, you may have different available options. But one thing that is the same is the standard design for next year. Now, these private insurance companies, whether it's standalone Part D or Medicare Advantage, are allowed to enhance Medicare standard design, but they can't have anything less than this design available for your clients. So how does it work? Well, starting in 2023, phase 1 of Part D's standard design is the deductible phase. This phase has been involved in Medicare Part D since the inception. This year, for calendar year 2023, the standard deductible is $505. Now, what a deductible means is the client must meet paying $505 in deductible before the Part D coverage kicks in, if it's standard design. But many insurance companies choose to enhance this benefit. For instance, if you're offering your client a Medicare Advantage plan, a Part C plan that puts all of the Medicare benefits under one umbrella, many of those plans choose to waive the deductible altogether for all tiers of medication. So the $505 is off the table. This is one of the perks to going with the Medicare Advantage plans. They offer a lot of enhancements, and one of them may be waiving this Part D deductible. Now, to know exactly how it works for each plan, you want to review the summary of benefits of that plan and make sure you're crystal clear as you're communicating with your clients. Most standalone Part D drug plans, if they're low cost, and by low cost, I mean less than $30 per month, generally they have some form of the deductible of the 505. Many of the low cost plans that are available will waive the $505 deductible from tiers like tier 1 or tier 2, which are typically generic medications. Some plans don't eliminate the deductible at all, and some plans waive the entire deductible, but you're usually looking at a price tag in the neighborhood of about $70 per month. So the take-home message is the plans can improve the $505 deductible, but they definitely have it incorporated in their booklets. You're going to see it there. You just don't know how they're treating it until you dig under the hood for that particular plan. Now, phase 2 of the standard design for next year is what they call the initial coverage limit, the ICL. So open any standalone Part D drug book or any Medicare Advantage book, you're going to see this lingo in these phases for the Part D prescription drug benefit. I like to think of the ICL like a bank account of prescriptions for your clients. The bank account gets a deposit on January 1st, and this year's deposit is $4,660. This amount has actually increased from 2022. That's a good thing, right? This is more dollars to work with for your clients for their prescription drug needs. What comes out of the ICL, and every drug plan is required to keep your clients up to date of what's coming out of the ICL every single month in the form of a statement. What comes out is the retail negotiated price for the prescription. So let's say you have a client that's taking atorvastatin, a very low cost, reasonable, generic medication. Let's say they're on a plan that waives the deductible for atorvastatin, not particularly uncommon. So right away, they're going to have first dollar coverage. Maybe atorvastatin is listed as a tier 1 on the carrier's formulary. Maybe that copay is 0. So your client goes in and pays nothing when they go pick up their atorvastatin for a 30-day supply, in my example. But the insurance company is paying something on behalf of that client. Let's say that something is about $20. Very reasonable, because that's a low-cost generic medication. However, that $20 is still coming off of the bank account, even though the client didn't pay anything. So in this example, it goes from $4,660 available to $4,640. So it's coming off of the bank account every single month. Now, if you're working with clients that take low-cost generics like amlodipine or atorvastatin or losartan, the chance of them using up their bank account in the given calendar year is relatively minimal. However, sometimes you have clients that are taking high-priced brand names. We all know the names of some of those we've seen with our clients. So for instance, let's say your client is taking a very expensive medication like a blood thinner like Xarelto or a blood thinner like Eliquis. Those drugs are very expensive. I've actually seen recent retail prices around $600 per month. That's very, very expensive for that medication. In that example, the $600 medication, on many plans, your client is going to have to meet that $505 deductible first. And then even once they've met the deductible, that prescription is typically going to be on a higher tier, a brand name tier, and their monthly copay for that prescription is going to be higher. Usually it's in the range of $40 to $50 per month for a prescription like Eliquis or Xarelto. Be careful with some of the Part D drug plans that are charging percentages for tier 3. That could add up substantially on some of your expensive medications like Xarelto and Eliquis and others. So be very, very careful to look at that full formula to see how that might work. Now, in the example I gave, let's say that medication retails for $600. Maybe your client only paid $47, which was their copay, but the full $600 is coming off of the bank account. So you'll see if you're taking a prescription that costs $600 per month on a retail price, or your client is, before the year expires, they're going to have exceeded their $4,660 in initial coverage. So what happens then? If your client goes through the entire ICL, they use over $4,660 worth of prescriptions in the year. For 2023 in the standard design, they're going to move on to phase 3. And phase 3 of Medicare standard design for next year is a 25% co-insurance. It's called being in the gap. They used to call it the donut hole. It was appropriately called the donut hole when people had to pay 100% of the cost. Now it's done to 25%. There's legislation out there that eventually this is going to go away and the amount of out-of-pocket costs is going to be reduced. But for right now in 2023, nothing has changed. There is a gap, and during the gap, if your client uses more than this initial coverage, they're going to have to pay 25% of the cost of their medications. So it can go up substantially. So if we use the case of that Eliquis, if they were only paying $47 for their $600 medication for several months, now when they have to pay 25% of $600, their out-of-pocket cost is going to increase for the rest of the calendar year. So it's very important to understand this and explain this. And when you have your clients who are taking high-priced medications, they need to understand the impacts of what it's going to look like, in this case, in the fourth quarter relative to their prescriptions. So the question is always, well, I'm in the gap, can I get out of the gap? And beneficiaries can get out of the gap in phase 4 of Medicare standard design. In phase 4, this is what happens when their true out-of-pocket cost or their TRUE reaches $7,400. That means they have spent $7,400 out of their own pocket. If that happens, they move on to the catastrophic phase, which is typically 5% for the rest of the calendar year. Now, that $7,400 is a very intimidating, big number. So one bit of assurance that I have for you on this is that sometimes your clients are on medications that have drug manufacturer discounts. That can range anywhere from 10 to 90% off the retail price on the prescriptions. The government counts the drug manufacturer discounts when they're available towards the true out-of-pocket costs. So when you do the analysis for your client, you may see that it accelerates them getting to the catastrophic level a lot faster than actually spending $7,400 out of their own pocket. So the take-home message here is that medications are not covered 100%. You really do need to understand these different phases and make sure that your clients are educated, because even if they're not taking anything right now, that situation could change for them within the calendar year. So a basic understanding of how it all works is really, really important. In order to do a drug analysis for your clients, it's really, really important that you have the names, dosages, and quantities of all the prescriptions they take, along with the preferred drugstore, because every single plan has a formulary or a list of medications that they cover. A lot of times people will ask me, well, what's your favorite plan? Well, I don't have one. My favorite plan meets your needs and is lined up to your personal situation. And in order to do that evaluation, I need to understand what they take, what the dosage is, and down to the very specific level. I take a torvastatin, 10 milligram tablet. I have 90 pills every 3 months. I take one per day. I take an inhaler. I need to know that it's an 18-gram inhaler. I need to know how long that's going to last. Does one last 3 months, 1 month, 2 months? Not how many puffs per day, because all of the analysis tools don't go by puffs. They go by how often those need to be replaced. There's no replacement for that specific information. And in order to do a good job for your clients, you need to capture all that full information and run that through the analysis tools. Now, previously, most of you have been using Medicare.gov, which is, of course, still available to you. I will say Van Berg is paying for any agents that work with them on all of the products for a tool called Sunfire Matrix. It's incredible. Everything is automated on there. You can do your scope of appointment, you can do your applications, and you can send quotes for Part D and Medicare Advantage plans with their copays. And guess what? It stores all their pharmacy information. So when Mrs. Jones calls you back and says, oh, I forgot to tell you about this medication or my quantity changed, you're not having to redo the entire process on Medicare.gov. It saves all that prior information and allows you to make edits. So convenient and easy to use. Now, really, really important in the analysis to be able to see that. Now, all things being equal on cost and benefits, what are the other things that you need to look at with the plans? One is the star ratings. So star ratings are just getting released for 2023. You want to make sure you communicate what the star rating is for your clients on every plan. So this plan has a 3.5 out of 5-star rating. This plan has a 4 out of 5-star rating, explaining how that works and how star ratings are used. The government is monitoring those plans, making sure they're providing good access to care, authorizations are running smoothly, great experience at the drugstore, good experience with customer service. All these are components that are going to help your clients have a positive experience. So really, really important. Something you want to keep in mind is that some medications are going to have prior authorizations and quantity limits. You're going to see PA or QL in your enrollment tools or in your search tools or in the plan's online formularies. If you see PA, that means that your client's doctor is going to need to request prior authorization for that medication, and it's not guaranteed that it's going to be approved. So if you see a PA indicator, you need to communicate that with your client, make sure they understand that process, and work with their doctors to get approval. When a PA is required, I like for people to be on a very well-rated plan that has given clients good experiences. Then I have a good feeling that their doctor is going to have an easier experience getting that medication authorized for your client. So really, really important. If it says QL or quantity limit, that means that even if they take 3 a day, if there's a quantity limit of 1 per day, your client's probably going to need to get authorization to get that approved or have certain restrictions on how often they can pick up the medicine. So really, really important to communicate that. A couple more things to note: late enrollment penalties. So if you have clients that you're working with, especially at open enrollment, people want to do a Medicare Advantage with drug plan and that kind of thing. If they've never had Part D before, they could be subject to an LEP. While you're never going to be the one to communicate with them exactly what their LEP is, how it works is for every single month your client did not have Part D and was supposed to, there's a 1% penalty based on the national average premium. So for instance, if your client is enrolling in Medicare Part D for the first time effective January 1st, and they didn't have Part D and they were supposed to, they didn't have creditable drug coverage elsewhere for a 12-month period, that means they're going to have a 12% lifetime penalty associated with Part D. How the penalty is calculated is based on the national average premium for that calendar year. So let's say, for example, the national average premium is about $32 for 2023. Your client would be paying 12% of $32 for the plan year 2023. If in 2024, the national average premium was $40, they would be paying 12% of $40 for that calendar year. So it doesn't go away. So you want to make sure that you're encouraging clients to take Part D if they're eligible, if they don't have creditable drug coverage elsewhere, and explaining what the late enrollment penalty is, but don't provide them the exact calculation. That's between them and the government on that. Be sure to remind your clients to set up payments for Part D for 2023. That can be a trouble spot. Sometimes clients get disenrolled because they didn't realize that they were supposed to be setting up payments for the next calendar year. So just make sure you remind them, check their payments in January, make sure the money's come out and they've got that taken care of. Now, a couple things I like to point out: IRMA, income related monthly adjustment amounts. If your clients are high earners, in 2023, a high earner is an individual making more than $96,000 in calendar year 2021. And I think you'll double that for a married couple filing jointly in 2021. If they've made less than that, then no income related monthly adjustment amount will be assessed for 2023. If they've made more than that, they will automatically be assessed an income related monthly adjustment amount. Now, I have that whole schedule of how much they'll be penalized in the form of additional tax, not penalized, but additional tax and income related adjustment amount. So if you need that, you can come to me. I have that in a PowerPoint slide I can share with you that you can share with your clients. Just makes it easy to communicate and share that information. Now, the other thing that you should note is sometimes you're working with clients that have had a situation change in that calendar year. So for instance, maybe in 2021, they were a high earner, but in 2023, they've already retired now, or they've got married or divorced, or they've reduced their hours. Any of these things could trigger reconsideration of their premiums. reconsidering premiums can be worth high value for both Part D for drug and Part B for boy. So if you have clients who've had an income-related change in 2023 and it's a qualifying reason, they might be eligible to get their premiums reduced through a process called reconsideration. It's a pretty easy process. They can call Social Security to do it, and Social Security also publishes a new form each year. The key is doing it in a timely manner. They want to, within 10 days of the qualifying event or being notified that they're a high earner for the year, respond to Social Security with their reconsideration information. This has been high value for many of our clients and really distinguishes you from them doing this on their own. So this is a way for you to provide additional service. I also want you to be aware that some of your clients might be eligible for extra help on prescriptions. This is the other route. They're not a high earner, but they have low income and low assets. If they're eligible for extra help, that can actually get them premiums reduced or eliminated and copays reduced or dramatically reduced or partially reduced. It also can help waive deductibles, and it can eliminate gap coverage for certain beneficiaries. So if you think you're working with people who are low income and low assets and you need help with extra help, there's specific links that we have available to you that we can share with you here at BlackPoint Insurance. So just want to really encourage you to be all inclusive, be helping your clients with this process, and be very detailed in communicating that information. So just a couple things about me here. So you see Erin, I'm Erin Ackenheil. I want to thank everybody for your attention today and learning some basics about the standard design for Part D. I'm going to be back with more information on Part D, giving you a tutorial on how we log that information into our Sunfire tool and analyze a beneficiary's needs. I'm going to give you more information on access to scopes of appointments that you can do electronically and how you can do everything online in terms of your enrollment, either with an enrollment pearl or doing it yourself. So I'm glad to come back and bring that available to you. For today, I have one goal right now, and I hope you'll help me with my goal. I'm trying to increase my subscribers on YouTube. My goal is to get to 1,000 subscribers. If you're listening to this and you want to help me support and grow, please go to YouTube. I know you have it. Search for BlackPoint Insurance, and when you find it, you'll see my picture on there and tons of educational trainings and videos, Medicare 101s, Medicare Minutes, things about how to be an entrepreneur and grow your business. If you click subscribe, you'll have direct access to that at all times, and you'll help us grow, and we'll be able to continue to provide all of these trainings free of charge. So I just want to thank everybody for coming today. I appreciate your likes and loves for being here. Not a lot of comments or questions, but I encourage you, if you do have comments or questions, please don't hesitate to reach out to the office and set up time with me or email us. I'm happy to help you in any way that I can. And for now, thanks everybody. Have a wonderful day. Talk to y'all real soon.